heavy periods and the amount of fragrances you use, which are endocrine disruptors, are related. But like there is not time to talk about that in med school. There's not time to talk
Mm-hmm.
about it in PT school because there's so
Yeah.
much other information. So being able to advocate for yourself, being able to do your own research, all things we'll talk about here are really important. Okay, we are here on the well-being to talk to you about all the things in this world that could help you feel like your best self. And I think, well, I know that most people in the world feel like they're normal, but it mostly usually could be better. So my name is Dr. Madison Oak. I'm a vestibular physical therapist. I'm a physical therapist. But I treat dizziness disorders, but I have a really significant interest in wellness and toxic products and the stress of the world and all the most bizarre, not bizarre, but like things that we could be doing better as humans and how to simplify that for myself and for my patients. So yeah, I'm excited.
I'm excited too. And I am Rachel, also physical therapist, completely different route in the pediatric realm, specifically babies, which is my favorite to treat, but all things in that realm. Learned a lot about the baby industry, baby products, all the different things that go on there, but also share a similar passion and hunger for new information, new knowledge that I've learned. And this is, me and Maddie text back and forth all the time about new things that we learn, just because we need to keep updated on all the things and make sure we're not doing anything, incorrectly. So, also very interested in health and wellness. I think similar to what you said, Maddie, about we are all kind of existing in this world. And I think it's become really normal for us to exist with issues like, oh yeah, my stomach hurts every day. It's like, no, like let's not do that. Let's feel better, or
Hmm.
let's figure out how to be well every day and feel good every day.
Yeah,
So
I
I'm
totally
also very
agree.
excited.
I totally agree. And I think on your point of like, I feel normal, my stomach hurts every day. Like, that's not normal. Like, having cramps on your period is not normal. And these are things that we're just like conditioned to believe are normal to the point where you might, I mean, you probably don't have patients like this, but I have a lot of patients where they'll be like, I'm in perfect health. Everything about me, like all my labs are normal, everything's normal. And then they hand me a list of 27 medications that they take every single day. And I am like not saying you shouldn't take medications or should take medications, but like if, and like myself included, I take one, my thyroid medication and multiple supplements every single day. And I think of them kind of in a different bucket, but also like similarly to support my body because it's not functioning normally. And it's like, how can I get myself to function better, more normally, all the things? Because, like, despite if your labs are normal, it doesn't necessarily mean like you're not on, I don't know, like the reason my vitamin D lab is normal is because I'm taking vitamin D every day,
Right,
not because I'm
right.
outside enough.
Exactly. Yeah, that's such a good point. And I think that's something that we don't think about a lot. I mean, I think you and I are conditioned to think like this, especially from going to PT school and like finding the actual root of the
Hmm.
problem, versus just like when it comes to PT, if somebody comes in, I said root correctly.
I
Yes,
know,
stop.
I'm laughing over here. Rachel says rut
I say
instead
root,
of root.
but I cannot say root. So I think when somebody comes into physical therapy and they're having an issue, especially like the traditional orthopedic realm, which neither of us touch, but like even it hits with vestibular and it hits
Mhm,
with pediatrics. When somebody comes in and has an issue, you can't just prescribe a medication, like
mm,
I can't just like kinesiotape somebody and be like, oh, you're good to go. Like you have to
mhm,
actually address the issue. And I feel like this is something that we both knew probably going into PT school, was reinforced in PT school, and then reinforced like through both of our specialties as
mhm,
we've treated outside of there. And so I think that's such a good point about medications. And I think just the way that our healthcare system exists today, which is a lot of just helping something that's already happened instead of trying to prevent something from happening in the first place.
mhm. Totally. And I think that, like, there's a lot of what's the word? Like, discussion, discourse, controversy over the word, like, root cause. Like, some people will be like, "There's no root cause, like, this just happened because it happened." And I see this especially in the migraine world, so it's, like, definitely a trigger in that world,
Mm,
but not necessarily for everything else, but, like, your body doesn't make mistakes, like, your body's saying, like, your stomach hurts every day, or you're having migraine attacks every day, or your knee is in a lot of pain despite not, like, having sprained it, right? Like, it just started hurting, like, your body is telling you something, and getting to the root of that, whether it's, like, different lab values or the amount of stress in your life, because the amount of stress in your life matters more than we give it credit for, like, our our other colleague, Dr. Jenna, she always says, "Just because you're not busy doesn't mean you're available." But we all have this, like, thing drilled into us. We're like, "Oh, I'm not doing anything right now. I can do that for you. It's not gonna be a problem. No way. All good." And it's like, we are so busy for literally no reason,
mm,
and I was talking to another patient about this the other day, and she was like, "Well, like, being that busy and working that hard is, like, what got me to this position." I'm like, "That's awesome." But, like, some of the most highest performing, most successful people in the world look for blank space in their calendar because it regulates their nervous system and gives them the ability to, like, think. And I'm
mhm.
not saying you need to be like a Fortune 500 company. I know that I am not, but, like, you do need to
Yeah.
give yourself time and space and all the things, and it's something that, like, I am not good at, but, like, working on.
Yeah, that's so true. And I was reading, or I read this book. I don't know if you've heard of it. It's called Scarcity Brain.
I have heard of it, but I haven't read it.
He wrote The Comfort Crisis, which I think I've talked to you
Okay,
about,
yeah,
like the whole misogi idea,
yeah.
which if you haven't read this book, it's fantastic. Um, and so he wrote a second book. Basically, the idea behind it is that the way that our world exists right now is that we have so much information being thrown at us at all times that we're kind of built like that,
Mhm,
especially in the work world.
mhm,
And even just like social media, like we constantly need like a new hit, and
mhm.
new hits are like new information or like overworking yourself or all of that kind of stuff too. So I think that's so true. So true. Um,
It is so true.
and I mean, to another point of why we wanted to start this podcast, I wrote down one of his quotes because I just thought it applied so well. I'm going to find it. But I think something that is so difficult in the healthcare world today is how much information is out there, and like the
Mhm,
information that you're getting from your formal doctor or your nurse practitioner or
mhm.
whatever, and then all this other information that you're getting from other sources that are accessible like social media and stuff like that. But his quote from the book is that we today are exposed to more information in a single day than a 15th century human would encounter in their entire lives.
That is one of my favorite facts.
Have you heard that
It's
one?
yeah, it is so it blows my mind, like, Shakespeare had as much information in his lifetime, just to, like, give you a person who represents that, than we do in a day.
Insane.
It is wild, like, we as humans are not meant to be exposed to this much information. It's really hard to get through. It's really hard to determine, like, what you should listen to and what you shouldn't listen to. And, like, I think that there's been a lot of mistrust in the healthcare field, and honestly for good reason, because, like, people are getting sicker and, like, at least in where I work, like, are getting gaslit, like, "Oh, that's not possible. Those things aren't related," whatever, when they absolutely are.
Mhm.
Like, heavy periods and the amount of fragrances you use, which are endocrine disruptors, are related. But, like, there is not time to talk about that in med
Mhm.
school. There's not time to talk
Mhm.
about it in PT school because there's so
Yeah,
much other information. So, being able to advocate for yourself, being able to do your own research, all things we'll talk about here are really important.
definitely. Yeah. And time is such a big factor. And I love that you said that because I think even like time in school to learn, but
Mhm.
then also like once you exit, and both of us being in the healthcare profession and medical field, once you exit that and you start treating patients in a more, even like a more neither of us are really in a formal normal setting anymore, but we've both worked the normal setting, which
Mhm.
for PT, for PA, for my sister's and a doctor, you see like 15 to 20 patients a day.
Mhm.
And it's impossible to keep up with all of these things, like what you just
Mhm.
mentioned with like fragrances. And it's impossible to educate on everything you need to educate and then also add all these other things in maybe like 20, 30 minutes. Like
Totally.
it's just the way everything is set up is so difficult. And I think both in the healthcare system as a healthcare provider, with healthcare being a business, and that I think to your point is so true about like how important it is to do your own research and become your own advocate for
Mhm.
your healthcare journey.
Absolutely. Will you check what your speaker is, if it's your headphones or your actual microphone?
Yeah.
Because you moved your head and then it sounded louder.
Hmm. Should be my microphone.
Oh, then it's probably fine. I don't know. I'll edit this out, I swear.
Keep it. How do I know I checked this last time.
The
Oh,
audio
wait,
on
wait,
the
wait.
bottom,
I get it.
the little like carrot arrow.
Does this
Is that
sound
right?
different?
Let's talk
Does this sound different?
a little bit.
Okay. I think I switched it.
Okay.
Wait, no, no, no. Sorry, I'm like same as system built-in microphone internal. It'd be an external.
Mhm.
Okay. Now it's the microphone.
Okay.
Okay.
Okay. Anyway, I mean, I don't think it's gonna make a huge difference, but
We'll get better.
um, yeah. Um, but no, I think being your own advocate, which I think if you're listening to this, well, I know if you're listening to this and you send either of us a message, you can email us at iamthewellbeing@gmail.com, or you can send me a message. I'm at the Vertigo Doctor on Instagram, or you. What handle are you being messaged at?
We are baby fit providers on Instagram.
Baby Fit Friday. And then wait, what's our Instagram handle?
Well, let's look. I think that okay, we are the well-being dot pod on
Oh,
Instagram.
okay. So if you guys are listening to this and you're like, I want to learn about like a specific thing, we're going to try and break it down like as simply as humanly possible. And if you want to message us, find at thewellbeing.pod and message us what you want to hear, because then we can like very specifically talk about those things. We have a lot of ideas of things to talk about. Um, between like how to be your advocate and like figure out what to do for yourself, your body, how to talk to your doctor, how to find a doctor who listens to you, all those things, but also like, are plastics bad and do we need to switch out our cups? Do you need to get rid of everything with a fragrance in it? The answer is probably. Should you have plants in your house? Do you need to stop watching TV before you go to bed? Like things like that that are like hot topics, but you're like, should I really be doing this? And my answer personally, I don't know about you, is like, if I think that potentially it could benefit me, I'm probably going to do it. But I'm also the kind of person who I have a hard time with like other people's change, but I'm really good at personal change. So like if you told me like you need to start doing X, Y, and Z tomorrow, I'm like, no problem, gonna do it. But that's also not everyone's personality, obviously. So we're gonna talk about very specific like things to do at the end of each episode. And kind of like really drill down to like two or three things. Hey, do this, this, and this if you want to change this thing or whatever, to try and make it as straightforward and simple as we can.
Yeah. Because at the end of the day, you are your own advocate. So
Mm-hmm.
we'll try and sum everything up super easy at the end. You pick if you want to do it. Hopefully, things that you can implement like that day or the next day
Mm-hmm.
that aren't stressful, overwhelming, and will make a difference pretty immediately.
For sure. For sure. And
Mhm.
I mean, I think that like if you listen to this podcast every week for a year, you will have changed 52 things about your life. And like that's a huge amount of change and a lot of things. So if you're like, I'm not going to do all those things, I don't think that you should be mad at yourself or like frustrated or upset, like choose 2 or 3 and like forget about the other ones because literally all we can do is our best. And if your best is like this year, I can focus on changing 2 things or even 1 thing, like that's better than before.
Definitely. Definitely. And I think after you do it, you're like, oh, I didn't even remember that I did all those things. But
Mhm.
at the end of the year, if you can look back and see how
Mhm.
many things you've actually changed and how much better you
Mhm.
feel, makes a huge difference.
I totally agree.
Yeah.
Totally agree. We're gonna talk
Yay.
about a lot of fun stuff. I'm
We have
excited.
so much good stuff, and I'm so excited to talk about all of it.
I am really excited too. We're gonna start with plastics and genetics, which are like 2 huge things. We'll talk about I don't know, we'll talk about hormones and nonstick pans and alcohol and sleep and if you should breathe through your nose and mouth taping and all the things, which the answer to
Yes.
all of these things are probably just in the short, like we probably shouldn't use them slash we should probably breathe through our nose.
Yes. Maddie taught me this earlier
You
this
thought I
year.
was crazy?
And I was staying at her house and for the first time, and she like came into my room and offered to tape my mouth shut. And I was like, I don't know about that. We'll get more into that one, but it has changed my life. And as we all know, sleep is so important, and
Uh-huh.
a good night of sleep actually changes everything about your whole body and mind. So,
Totally. I was listening to a
yes.
comedian the other day and she was like, "Okay, yeah, we all know we need 8 hours of sleep. Like, we know. You don't need to tell us." And I was like, "That's a really good point. Everyone does know." But how to get there is really hard sometimes. So there's a lot of steps on how to get to 8 hours of sleep.
Yeah,
Yeah,
definitely.
definitely.
Oh, it's gonna be so fun. I'm so excited to talk about all the things. And
Me
also
too.
feel free, like Maddie said, to message us if anything that you guys want to know more about. We
Mhm.
are excellent at digesting and
Mhm.
dissecting research articles. So
Yes.
we'll be looking into all the things so that you don't have to, because it's not very fun.
Yeah, no, reading research is rough and not fun, and, like, determining if the methods were done correctly is, like, such a pain. So, we will do it for you. We're gonna have a lot of, like, clinical evidence and research-based evidence, and if there is something that we do that doesn't have, like, the exact, like, clinic or research, placebo, double-blinded control trial, we need to remember that the way to push science forward is to take clinical experiences into I said that word experiences into account and then do research on those things. But we also have to remember that like funding is few and far between and it's hard to get people to do these things and to find someone to pay them and like all of those things. So definitely remember that when we're thinking about and talking about like everything here. We're going to do our obviously our very best to find the research, but sometimes the double blinded placebo control trial literally just doesn't exist.
Yeah, not, I mean, and in pediatrics, I'm going to tell you right now, like it is near impossible to find. But
Same.
that's why we will be having guests that have
Mhm,
clinical expertise and a lot of experience and all of that type of stuff
mhm.
too.
Totally. Absolutely. The same as
Mhm.
with vestibular disorders. There's like I was just texting a patient a research article. I was like on a medication. I was like, you can send your doctor this medication, but they're probably going to look like you have 6 heads. But there is one research article that exists that's like a clinical, not even a clinical trial, like a
Like a randomized
no, it's literally like a clinical opinion from one patient who it helped. But clinically, I see it work all the time.
Hey, that's what you need in cases like this. So,
Totally.
yeah.
Totally.
Okay. Awesome.
Awesome.
Anything else that we need to share in our pilot episode?
I don't think so, but I'm really, really excited for this. Like, I feel like I'm equally as obsessed about talking about this as I am about vestibular disorders. And if you know me, I am literally obsessed with talking about dizziness and vestibular disorders. So
Yes,
I'm
agreed.
excited.
I could talk for way too many hours on everything baby related. So, and this, I'm so excited. And you guys, if you're not that interested as me and Maddie, at least come hang out because we're pretty fun.
Yeah, we are pretty fun. And you'll learn something that could
Definitely.
possibly impact your life literally forever. All right.
Yes.
Yay.
Okay.
Thanks.
Cool.
Bye.
Bye.